my name's Sarah. I'm a student nurse practitioner working at the office today. How are you?
I'm doing well. How are you?
What's your name again?
Eric.
Nice to meet you, Eric. Do you know the role of a nurse practitioner?
Not really, no.
Alright, so we take our own boards exam and we are prescribers. We're able to evaluate any health problems you have, make a diagnosis, and treat whatever you need us to treat within our realm of practice. Do you have any other questions about that?
Not particularly, no.
Wonderful. And how would you like to be addressed today?
Eric is fine.
Wonderful. And then just going to go over some basic information with you right now. So name is Eric Zeich. When is your birthday?
May 29, 1988.
Wonderful. And what is your address?
53 Braemar Drive, Elk Grove Village, Illinois.
Okay, and your phone number?
309-830-1780.
Alright, and then, let's see. And then where do you normally get your health care from, since this is the first time we've seen you in our office today?
I usually go to Alexian Brothers. I have a primary care there.
Okay.
That I used to go
Okay. And then what brings you in to see us today?
to. Just my yearly checkup.
Yearly checkup. Okay, wonderful. Alright, so let's go ahead and get started. So yearly checkup. And what was the reason for your last examination?
My annual. I haven't been since the last year, so
Okay.
it's time for me to come in again and check
Wonderful. In the past, have you had any chronic illnesses that you'd like to
Nope.
tell me about?
Mm-mm.
No? Okay. Any mental health issues?
None.
No? Okay. Let's see. And then any concern about your health or well-being today that you'd like to discuss?
No, not really.
Okay, so just a general checkup.
Yes.
Wonderful. And then how are you on your immunizations? Are you currently up to date?
Yes, I am.
Have you had your yearly flu shot?
Mhm.
Okay. And then have you ever had a pneumonia vaccine?
No.
Okay. You're a little young. And then what about your Hep B vaccine? Are you up to date on that?
I'm not sure. Yes, I think so. I'm
Okay.
pretty sure.
And then what about your last tetanus shot?
I'm not sure when it was, but it's recently.
Okay. Okay.
I'm
Great.
not sure on the exact date.
Okay.
Definitely recent.
And then do you have any allergies to any medications that you know
No,
of?
none.
Any allergies to food?
Mm-mm. No allergies.
And then any allergies to any over-the-counter medications? Like
Nah, nothing.
any latex
Mm-mm.
allergies?
Nope. I
Okay.
have no allergies.
And then any allergies to penicillin?
No.
Okay. Have you ever had penicillin before?
I don't think so.
Okay. Okay.
But
All right. And then have you ever been in the hospital for anything?
no. not
Any
really.
surgeries?
No, nothing like that.
Any major injuries?
Mm-mm.
No? Okay. All right. And then any car accidents or anything like that? Major accidents
Oh,
that
no,
you would have
nothing
been?
major, no.
Okay. All right. All right, now let's move on to your medications. Are you currently taking any prescribed medications?
I'm taking none.
Okay, do you use any over-the-counter medications?
Not really.
No? No. Do you use any herbal remedies
No.
or homeopathic medications?
No, nothing like
Any vitamins?
that. No.
No? Okay. And then do you use any kind of complementary or alternative therapies such as acupuncture or oriental medicine?
Oh, no, nothing like
Do you go to a chiropractor?
No.
Or a prayer doctor?
No.
No? Do you use any special diets or vitamins?
that. No, not really.
Okay, wonderful. All right, so do you know anything about when you were a kid? Did you have any issues at birth?
I don't think so. Not that I'm aware of.
Okay, any cyanosis or jaundice, congenital abnormalities?
Nope.
Did you have any difficulty eating when you were a child, when you were
Nope.
first born?
Mm-mm.
Okay. And after your mom had you, were you just discharged home right away?
I believe so. Yeah.
Okay. All right, so let's talk a little bit about your family history. Did you live at home with your parents when you were growing up?
Yes, I did.
Yes. And do you have any siblings?
I have one sister.
Okay. And then can you tell me about how their health is right now? Let's start with your mom.
My mom's health. She's in good health.
Good health.
Nothing of note that I'm aware of.
Okay. And then what about your father?
Father's the same.
No health conditions such as heart disease, diabetes, anything
I don't
like
think
that?
so.
Any cancers
No.
for either of your parents? Any blood diseases?
No.
Obesity? Any vision problems?
No, not problems, just contacts and glasses.
Okay. And then what about your sister? Is she in good health?
Oh yeah, she's same as us.
Okay.
Pretty sure, so.
And then let's talk about your grandparents, move on to them. Any issues with your grandparents? Are they still alive?
They are alive.
All four of them?
3 of them.
Okay.
One
And
is deceased.
which one?
My father's mother.
Okay. And what did she die from?
Natural causes.
Just old
Just
age?
Old age, yeah.
Okay, nothing specific
And then
like
the
cancer?
others, yeah, no, it's nothing like that. Everybody else is alive and kicking. Yeah.
Okay, and then just to go back to your parents, do they have any mental health problems or any addiction problems?
No.
No, okay. All right, so any other concerns about your family that you'd like to let me know about?
Not off the top of my head. No.
Okay, all right. And then who do you currently live with?
I live with my wife.
Your wife, okay. And is it just the two of you?
Yes.
Let's talk about your job a little bit. Can you tell me what you do for a living?
Yeah, I do data entry, so I sit at a computer for 8 hours a day,
Okay.
40 hours a week.
So I can't imagine, are you exposed to any occupational risks at all?
Oh, no, not at all. No.
Okay,
Nothing like
any exposure to any violence in your job? No, okay.
Not at all.
So the only thing is just sitting for 8 hours a day?
Yep.
Okay. And any up and movement during the day, or pretty much just sitting all day long?
Minimal, but it's a lot of sitting.
Okay. And then, do you currently have insurance?
I do.
You do. And do you feel like it adequately kind of takes care of you for your health problems?
Yeah.
Feel like you're able to go to a provider and get the help that you need?
Sure do.
Wonderful. And then what about your family? Do they feel like they have the help that they need in terms of like health needs, insurance?
Yeah, I'm pretty sure.
Yeah, okay. Wonderful. And then what level of school did you complete? Did
I
you
have a
finish high school?
Bachelor's degree.
You have a
4 years of
bachelor's
college,
degree?
yes.
Okay. Okay, let's move into your habits now. So do you ever use any alcohol?
Maybe once or twice a month I'll have a few drinks.
Okay, just socially or?
Yeah, just socially, out at a bar or something like that.
Okay. And then do you currently use any tobacco products?
No.
Have you ever used any tobacco products?
No.
No, okay. And then do you use any caffeine and beverages?
I might have one every day or every other day.
Okay. And is it coffee or tea or pop?
It changes. It's usually tea or pop.
Okay.
I don't really drink coffee though.
Okay. And then, do you use any recreational drugs,
No.
such as marijuana, cocaine?
No,
None of those?
nothing like-
Okay.
No, nothing like that.
Okay, wonderful. Let's talk about your sleep patterns. Do you feel like you sleep through the night okay?
Yeah, I do. I
No
do my
problems?
8 hours or so. and
No, you say you
usually
average
7
about
to
8 hours?
Yeah.
Okay, and then let's talk about your activity patterns. Would you consider yourself an active person?
I would. Aside from being at work, I do like to engage in sports and activities in the evenings and on the weekends.
Okay, how many days a week would you say you kind of get some exercise or do some of these activities?
Oh, 3 to 5 days a week.
Oh, that's pretty good.
Pretty active.
And what kind of activities do you do?
I swim, I play basketball, I play water polo. I like to play a lot of sports.
Oh, that's
so.
that's quite a lot.
Mm-hmm.
You're a very fit person.
Okay.
All right, then let's move on to your kind of diet. Can you kind of tell me about what you ate, say, yesterday? Would you consider yesterday a normal eating day for you?
Uh-huh.
Okay, can you just kind of go through what you ate yesterday?
Sure. I think I had eggs and bacon for breakfast.
Okay,
And then just like a deli sandwich for lunch.
okay,
And then I had some lasagna for dinner with my family.
okay. Any snacks throughout the day?
No, I don't think so.
No snacks? How would you say your fluid intake was?
I drink quite a bit of water. Like 7,
Okay.
8 glasses maybe.
Okay,
a
that's
day or
great.
so.
Wonderful. And then, do you have any special dietary practices? I know we already talked about food allergies. Do you eat anything in particular?
No, I just whatever.
Okay, so you're no vegetarianism, or you don't avoid any products at all?
No, not
Okay.
at all.
All right. Let's talk about some stress management right now. So how would you rate the level of stress in your life?
On like a 1 to 10, maybe 3 or 4.
3 or 4?
It can. There are stressful events, but mostly I'm pretty chill.
Okay. And do you feel like you're able to cope with them okay? Do you have any specific methods that you use for coping with stress?
Not specifically, just this and that, whatever I feel
Okay.
like at the time. Kind of thing.
Okay, do you feel like your exercise helps cope at all?
Oh yeah, definitely. That's
Yeah?
what I like to do is work out if I'm getting a little stressed out or whatever.
Okay. And then, have you ever sought any mental health help for any stress that you've been facing in your life?
Mm-mm.
No? You feel like you have people that you're able to kind of go to when you have any problems?
Yeah, certainly.
Sure. Okay, and then let's talk about some exposure to violence in your life. When you were growing up, were you exposed to any particular violence, like in your family or outside of your family in your friend areas?
No, no. Not at all.
Any relationship violence that
No.
you've experienced?
Mm-mm.
Okay.
I didn't help hurt you, did I, when I was you
And
were
then-
me?
Just 1 second, okay?
I didn't hurt you, did I?
No, we're okay.
Phobias?
Okay, let's talk about the use of safety measures in your life. Do you use a seatbelt when you're in the car?
Yes, all the time.
When
Every
you're
day.
driving and when you're a
Mhm,
passenger?
Always, yep.
Okay. And then, do you bicycle at all?
I
Use
do. I
bicycle
do
at all?
bicycle a
Do
lot in
you-
the summer.
Do you use a helmet?
I actually do, yes.
Wonderful. And then, do you have any smoke alarms in your house?
Yeah, of course.
Any carbon dioxide monitors?
Yes, we have one. At least one.
Okay. And then, what about? Do you have any guns in the household?
No.
No. Have you ever had any guns in the household?
No, I don't think so.
No. Okay. All right. So we said there's no. Have you had any previous jobs, any exposure to any health hazards such as dangerous situations like being exposed to smoke or any violence or pollution?
Not that I can think of right now.
No.
Don't think so.
What about any lead or radon?
Not that I'm aware of.
Not that you're aware of course. And what about secondhand smoke?
Nah, not.
No.
Yeah, minimal, if any.
Okay. And not at home or in work
No,
environment
no,
at all.
Not really.
Okay, and then what about, do you live in the Chicagoland area?
I do. Suburbs.
So you have appropriate access to clean water?
Oh, yeah, definitely.
Okay. All right, and then do you have any specific religious affiliation?
No, I do not.
No, you do
actually.
not. Okay. And then do you have any other faith that you kind of prescribe to?
No, not particularly.
Okay.
Nothing like that.
All right, now I'm going to kind of review kind of a head to toe, just ask you some questions about any symptoms that you've been having, and if you feel like you have any concerns or anything, kind of let me know as we go, okay?
Okay.
So we're just going to kind of start with some general symptoms. Recently, have you had any fever or chills?
Nope.
Any kind of just achiness or not feeling right?
No.
No, you feel okay?
I feel pretty good. Yeah.
What about when you're sleeping? Do you have any kind of night sweats?
No, I
No.
usually sleep right through just fine.
Okay, and then what about your weight?
Pretty constant. Doesn't fluctuate much.
Doesn't? Okay. And then have you ever felt like you needed to lose weight or gain more weight?
No, not really.
Okay, so it's kind of just stayed the same.
Yeah. Mhm.
Okay. And then let's talk about the level of pain you're in right now. Scale of 0 to 10, 0 being no pain at all, 10 being the worst pain of your life. What would you say?
0.
0,
Yeah,
okay.
No pain right now.
Wonderful. And then have you noticed any changes in your skin anywhere in your body? Any new moles or marks anywhere?
Mm-mm.
What about any rashes?
Nope.
No? And then what about your nails? Have you noticed any changes on your fingers or toenails?
No changes at all.
Okay, and then how often do you use sunscreen when you go into the sun?
Usually if I'm outside more than a half an hour, I'll wear it. Or,
Okay.
if I'm going to be out there for more than a marginal amount of time.
Okay, and then do you kind of monitor your skin to make sure that you don't have any problems after you've been in the sun?
Oh, yeah. I do. On occasion,
Okay.
right?
Okay. And then let's talk about your hair and scalp. Have you kind of noticed any changes in your hair recently?
No.
Any bumps or lumps or kind of the distribution of your hair? Has it changed at all?
Oh, no, nothing like that.
Okay. And then glasses. Do you use any glasses?
I do. I wear contacts.
do,
Yeah, I use
okay.
glasses.
And then when was the date of your last eye exam?
Maybe 6 months ago, approximately.
Okay. And then how have you been doing since your last visit with the eye
Oh,
doctor?
just fine.
Any
everything's-
problems with your contacts?
Not a thing.
Okay, and then do you by any chance know what your vision is?
It is.
Last visit?
Well, my contacts are minus 3.5.
Minus 3.5 in both
Yes.
eyes?
Uh-huh.
Okay. And then have you ever had any problems with glaucoma or cataracts?
Nope.
No, and then just general eye pain, no itchiness or redness recently.
Nothing like that.
Everything's been
Pretty
good.
good, yeah.
Okay, then we'll move on to your ears. Any hearing loss recently?
Not noticeably.
Any pain?
No.
Any like discharge coming out of your ears? No?
No, don't think so.
Any like kind of just hearing weird sounds or anything like that? Have you felt any kind of like spinning or feeling like you can't stand up straight?
No,
No.
nothing
And
like
then, do you use a hearing aid?
No.
Okay. All right. And how often would you say you get colds?
Oh, once every 3 to 6 months. Not very often.
Not very often.
I'm pretty healthy most of the time.
Okay, and then do you kind of have any other nose problems like constant drainage of your sinuses or
No, nothing.
any trouble kind of breathing through your nose?
Nah, just minor colds. It's the worst, as bad as it gets.
Okay, and then no sinus pain kind of in this area above your eyes or underneath your eyes?
No, not at
Any infections?
all. Nope.
None. Okay, alright. Alright, then let's talk about your dental habits. How often do you brush your teeth?
Usually once in the morning and once in the evening. before
Okay. And then how often do you floss your teeth?
bed. Maybe every other day.
Every other day, okay, okay. And then when was the date of your last dentist visit?
Oh, probably 4 or 5 months ago.
4 or 5 months ago.
Yeah, not too long.
And then how often do you go see the dentist?
I try to get in every 6 to 9 months.
Okay,
I try not to go more than a year, though.
it's a good idea. And then do you have any missing teeth or false teeth?
No.
Okay. And any other dental problems?
No, not a thing.
No, pretty
good.
Pretty good there. Wonderful. And then have you noticed recently any kind of stiffness or swelling in your neck?
Oh, no.
No, any abnormal lumps or bumps in your neck area?
Nothing like that, no.
Okay, and no tenderness when you kind of move your head around?
Nope.
No? Okay. And then we can talk about kind of your breast and chest area. Have you noticed any soreness in your breasts?
Nope.
Any tenderness at all or any abnormal discharge?
No, nothing.
Nothing at all?
No.
Okay. All right, and then going back to kind of your respiratory area, any cough, regular cough other than when you're sick?
No regular cough, no. Definitely.
Okay, and then what about kind of when you do cough, does anything come up, just a general, like, tickle in your throat?
It's usually just a tickle, yeah.
Okay, okay. And then, do you have any shortness of breath?
No, I don't think so.
Nothing,
No.
you're pretty healthy individual.
Yeah, right.
When you are active, do you have any shortness of breath?
No,
No.
not really. You just kind of go and go.
Okay, and do you experience kind of any, like, wheezing, like, trouble getting air in at
No,
all?
nothing like that, no.
Nothing. And then, do you have asthma?
No.
Okay. Have you ever been diagnosed with asthma?
No.
Okay. Any chest pain?
No, I've not had any chest pain.
Okay. Have you ever had anyone tell you you have hypertension or high blood pressure?
No.
No, blood pressure's been okay.
Right, yeah.
Anyone ever tell you you have any heart murmurs
No.
or high cholesterol?
Mm-mm.
No. Have you ever had that checked?
Yes, I have.
You have. Okay.
Right.
All right. Moving down the body, we'll go to your bowel habits. Any diarrhea or constipation recently?
No, nothing recent at
No.
all.
And how often would you say you have a bowel movement?
Once a day.
Okay.
Plus or minus one.
Okay. And then do you have to kind of strain when you have a bowel movement, or is it
No, it's not like a...
very normal?
Yeah.
Okay.
it's very-
Any problems with any nausea or vomiting recently?
No.
No. Any abdominal pain?
None.
Okay. And then what about food tolerance? When you eat specific foods, do you have any problems, or are you okay with just
I
any food?
eat pretty much whatever, yeah. I don't
Okay.
have to anything.
Okay,
that
nothing
bad.
makes you more sensitive or kind of feel worse?
Nothing I stray away from or anything like
Okay.
that, no.
Have you noticed any blood in your stool?
No.
No. And what about any kind of swelling in your glands in the groin area? Any problems there?
I don't think so.
No? Okay. Alright, we'll talk about your urination now. Have you any problem with having to go to the bathroom more often than normal?
Oh, no.
Any burning when you urinate?
No.
Okay. Any blood in the urine recently?
No.
Any incontinence where you're kind of unable to hold the urine in until you can get to the bathroom?
No.
Okay, you're pretty young for that.
Yeah.
So, what about any flank pain?
Like on my sides?
Yeah, yeah.
I don't really get much ache and pain and anywhere in my
Okay,
body,
no
so-
pain kind of in your back area or your
No,
sides?
not noticeable.
Okay, I'm just kind of checking.
Yeah,
Have you ever
of
had a
course.
kidney stone?
I have not.
Okay. What about any infections?
No, I don't think so.
Okay, and when I'm saying infections, have you ever had any sexually transmitted infections? No. None of those? Okay. What about any discharge coming out of the penis?
Nope.
None at all? Okay. And then, are you circumcised?
I am.
Okay. All right. And then, while we're on the topic, let's kind of talk about reproductive. Are you interested in having children?
Yes, eventually.
Eventually. Have you tried to have children yet?
Oh, not yet.
Not yet. Okay.
In the next few years.
In the next few years. Okay. Wonderful. And then, has anyone ever told you that you'd have trouble having children at all?
No.
Or, okay. So you haven't tried. You probably haven't had that checked yet.
No, not at all.
Sure. And then, have you ever had a prostate exam?
I have not.
Okay, you're a little young for that still. All right, let's talk about your sexual history a little bit now. If you're uncomfortable with any questions, just let me know. How many current or lifetime sexual partners have you had?
Just one in my life.
Just one? Okay. And then are you currently sexually active?
Yep.
Do you use any form of birth control?
No.
Okay.
I'm married, so I don't really need to.
Okay. All right, so let's kind of move on to the full body now. Do you have any problems with any range of motion in any of your body areas, like your arms or your legs?
No, not noticeable.
Okay, and you're able
Like
to
that.
kind of like move your neck around
yeah.
appropriately as
Absolutely.
much as you would normally
Oh, yeah,
like to?
no resistance or anything.
Okay, and you're able to kind of like bend as you normally would?
Yes,
all
very,
body
very flexible
areas.
and move well, yes.
Okay, would you say you have any complaints of like pain or stiffness in your joints areas?
Nah.
Like in your elbows or in
No,
your wrists
not
or your
noticeable
knees?
or anything like that.
Okay. Have you had any problems walking at all?
No.
Any problems running?
No.
Okay. All right, we're going to kind of move on to your head area, your neurologic system. So have you had a history of any head injuries
I
from...
have not had any head injuries.
Okay. Just asking when you played any sports or anything, if you've
Yeah.
ever had any concussions.
No, I haven't had anything like that before.
Okay. Have you ever had any loss of consciousness?
No.
No. What about any kind of like loss of coordination or dizziness when you're just active?
Oh, no, not really, nothing like that.
Nothing at all? Okay. What about any numbness in any parts of your body?
No, I don't think so.
Any tingling like in your fingers or your toes?
Nah.
Okay. Let's see what else. Have you ever had a seizure?
No.
Have you ever been diagnosed with a seizure disorder?
I have not.
Okay. Have you ever noticed any tremors in something like your hands?
No, not noticeably.
Okay. What about headaches? I know everybody gets headaches every once in a while. Have you had any regular headaches?
No, they're infrequent at most.
Okay,
Not
what
very
about...
often at all.
Sure. What about any migraines? Have you ever had any migraines?
I mean, I don't think so. My headaches aren't really very bad when I get them, so.
Okay. All right. Let's see where we're at. What about any kind of impaired thinking? Have you ever had any cognitive problems where you just can't think like you normally would?
I don't think so.
Okay. What about any kind of memory impairment where you can't remember something that happened?
No.
None. And then what about irritability or mood swings?
Pretty typical. I mean, not often, but
Sure,
everybody has their moments.
Sure, everyone has a bad day, but nothing kind of regular.
No, nothing that sticks out like that.
Okay, wonderful. All right, we'll kind of move on to blood. Have you ever been told that you are anemic?
Nope.
Have you ever? Do you have any tendency to bleed more than normal?
No, nothing like that.
You feel like you're able to create a scab kind of when you get a cut or
Oh,
anything?
definitely, right. Mm-hmm.
Okay. Have you ever had a blood transfusion? I know you've never been in the hospital before.
I don't think so.
Okay. You would probably know
Yeah,
if you
I
had
don't
one.
think so.
Have you ever been told you have any thyroid problems?
No.
No? What about kind of unusual sensation to hot or cold? Like cold things really irritate you?
No.
Any sensitivity to hot things on the other side?
No, nothing I can think of.
No? Okay. Let's see. And then have you had to urinate more than is normal for you?
Pretty standard.
Okay. Have you kind of had any excess like thirst lately?
No, don't think
It's
so.
been pretty
It's
normal
beyond
and standard.
baseline, right?
Okay. What about, so you say your mood in general is pretty good. Obviously everyone goes through some stress at some times. And I believe you said before you've never had any mental health issues. Any problems with anxiety?
No,
Any panic disorders? Any issues with any kind of just abnormal? No. What about depression?
No.
Do you feel like you're able to enjoy your daily
Oh
activities?
yeah, certainly.
Sure. And then we already went over mood swings. What about hallucinations?
No.
Do you ever see things that maybe people tell you aren't there?
No, I don't.
Okay. Have you ever had any suicide attempts?
Never.
Have you ever thought about committing suicide? Okay. Make sure if you ever have those thoughts, communicate them with somebody that you feel comfortable with.
Absolutely. Thanks.
Any problems with eating disorders?
Nope.
No. Feel like you're able to eat what you want?
I eat pretty well.
Have you ever thrown up after eating because you feel like you're not in control?
No.
Okay. And then you've never been treated for any of these problems
Of course
before
not.
because you've never had them. All right. Well, it looks like we've done a great job. Is there anything else about your health that you'd kind of like to let me know while we're here?
I don't know. I think we covered it all. Nothing I can
We
think
went
of.
through a lot today. All right. Let me just go through one more time, make sure we got everything. All right. It looks great. Well, it was very nice to meet you. We'll kind of move on to the examination now.
Okay, great. Thanks.
Thank you.